I'm Rachel Nugent, and I'm a Senior Health Policy Associate at the Center for Global Development. I'm working on drug resistance. Drug resistance is the problem where we have drugs that no longer effectively treat the diseases that we face. An example that we see a lot in the U.S. is MRSA, methicillin-resistant Staphylococcus aureus. It's simply an infection, but our typical antibiotics are no longer able to kick out that infection. So more people are now dying of MRSA in the U.S. than of AIDS. Outside of the U.S., we see a lot of resistant diseases. One example is multi-drug resistant TB. TB is a disease that's been with us for a long time, but now the standard TB drugs are not able to cure it. And it's showing up in 45 countries, and it costs much more and takes much longer to treat multi-drug resistant TB than ordinary TB. Even simple childhood diseases such as diarrheal diseases and strep pneumonia that we expect to be able to treat overnight when our children get it, those are now showing resistance to common antibiotics. So the Center for Global Development became interested in addressing this global health issue for three different reasons. One is people's incentives. When one of us gets sick here or anywhere, the first thing we want to do is get treatment for it and get rid of that disease. I don't have much incentive when I'm getting treated or my child is getting treated to think about whether that undermines somebody else's ability to get treated or whether it even undermines my own ability to get cured in the future. So my incentives do not lead me to think about resistance, and that's called an externality. Second issue is that drug resistance is a problem that is international in scope. Diseases and the bugs that cause diseases cross borders, and so when resistance occurs in one country, it can quickly move to another country. In developing countries, about 50% of drugs aren't used appropriately. People get too little or they get too much, they get it at the wrong time, it's a poor quality drug, all kinds of reasons why drugs can be used inappropriately. In developed countries, people use drugs inappropriately as well. Sometimes people take too much drugs. My interest in this issue came because I used to argue with a family member all the time who got antibiotics every time he went to the doctor, whether he needed them or not. In the U.S., more animals get antibiotics than people do in developing countries. So there are ethical issues and efficiency issues involved, and that got us very interested. Finally, drug effectiveness is a limited resource. We haven't come up with a new class of antibiotics since before the 1980s, which means that we all need to preserve the effectiveness of the existing drugs we have, because coming up with new drugs is very expensive. So our working group is addressing these issues, and we're looking at three different ways of understanding and solving the problem of resistance. One is happening in the health system itself. For instance, in a lot of developing country health systems, drugs run out. And so people get on-again, off-again treatment for TB and other diseases that are showing resistance. The second is that we need good new technology. For instance, if we had a way of checking whether people have resistance already to a drug, then they wouldn't get treated with that ineffective drug. And then finally, people's behavior. Some think of this as pushy patients and wimpy doctors. We need to have people not taking drugs when they don't need it, and we need to have doctors who aren't giving out drugs where it's not going to be useful. So we think that there are a lot of solutions, there are a lot of sources of this problem, but there are a lot of solutions as well.